This case presents the problem of an adult who experiences acute myocardial infarction, or AMI. AMI is defined as necrosis of a portion of heart muscle due to inadequate blood supply. Myocardial infarction often occurs when the patient is resting, sleeping, or involved in normal activities, and most often occurs in the morning hours from 6 a.m. to noon. AMI can also occur, although rarely, in cases of severe exertion. Whatever the cause, AMI is extremely serious as it can lead to sudden cardiac death. Skills needed for successful performance in this scenario include the AMI algorithm, recognition of the signs and symptoms of AMI, medications to consider for AMI patients, ECG and other criteria for thrombolytic therapy, inclusion and exclusion ECG criteria for AMI, and common arrhythmias in AMI. We will now see an emergency situation involving a patient who experiences acute myocardial infarction.
I really wish you wouldn't smoke in the house. Besides, you said you were going to cut down on your smoking.
Don't bug me about my smoking. I'm down to 2 packs a day, and that's the best I can do.
All right, just make sure you've got everything. The airport limo will be here in half an hour. I'll iron this shirt for you.
This man is at risk for having an AMI. The risk factors for AMI include gender, age, cigarette addiction, elevated serum lipids, history of high blood pressure, previous MI, sedentary lifestyle, and family history of heart problems.
Honey, what's wrong? You look awful.
It's just a little indigestion. I'll be all right in a minute. I just need a little time.
Honey, I'm worried. Why don't we go to the hospital and get you checked out?
No, honey, I'm all right. I just need to rest for a while. Why don't you call the airline and see if you can get me on a later flight?
Just let me call 911. They'll get someone over here, check you out, make sure you're okay.
I tell you, I'm all right. And don't call 911. I don't want all those flashing lights and sirens and neighbors looking to see what's going on. Just see if you can get me on a later flight. I'm going to lie down for a while.
All right, if that's what you want. I'll call the airline.
Many patients with possible AMI are reluctant to seek care due to embarrassment, denial, or unwillingness to transfer decisions to others. The average delay in seeking help is 3 hours. The National Heart Attack Alert Program has noted that these delays in seeking help are the major barrier to achieving the maximum possible effectiveness of thrombolytic agents.
I've booked you on the noon flight. The limo will be here at 10:30.
Honey, I feel awful. It feels like someone is standing on my chest and won't get off. Maybe you better get the car and take me to the hospital.
Maybe I should call 911.
Okay. Maybe you should.
Hello? My husband's having chest pains.
Whenever possible, patients should be encouraged to call 911 rather than transporting themselves to the hospital. The pre-hospital goals for the management of this patient include relief of pain, providing medications which may limit infarct size, and availability of early defibrillation to prevent sudden death.
This is EMTD Jackson, en route with patient complaining of severe chest pain. We're giving him oxygen, 6 liters per minute nasal cannula, monitoring vital signs which are stable, ETA 10 minutes.
Patients with chest pain must be approached with the same urgency as patients with acute seizures. These individuals may be experiencing ischemia and infarction. The first priorities in treating patients with chest pain are administration of oxygen, obtaining IV access, and hooking the patient up to a monitor. Oxygen is probably the most important and effective agent in emergency cardiac care and should be initiated whenever AMI is suspected.
Okay, Mr. Schuler, what I'm doing right now is I'm going to hook you up to our cardiac monitor so that we can watch your heart, okay? That oxygen that I just put on you should alleviate some of that chest pain that you've been having and help your breathing a little bit.
What do we have, Terry?
This is Mr. Schuler. He's a 55-year-old male who started having severe chest pain at about 5 o'clock this morning. It has gotten worse during the day. His blood pressure has been running about 160 over 106. Heart rate's around 100. Respirations are 26 and shallow. His pulse ox is about 96%, but he does say that he smokes about 2 packs of cigarettes a day.
Mr. Schuler, my name is Dr. Barton. Listen, I need to ask a few questions to start off with. First off, on a scale of 1 to 10, 10 being the very worst pain you've ever felt, what do you feel like at the moment?
About a 9.
Do you have any allergies to any medication?
No.
Are you taking any medication at the moment? Do you have any kind of a history we need to worry about? Have you ever had this experience before?
No.
Any other problems, diabetes, hypertension? Let's start him off with a chewable aspirin. I want to give him, follow that with 1 single sublingual nitro. I'm going to want an IV line open as soon as you can, and I need an ECG stat.
You got it.
Let me know if there's any changes. I'll be back in a few.
Okay, Mr. Schuler, I'm going to give you 2 different medicines right now. The first one is a chewable aspirin. I just want you to chew it up very well and swallow it, okay? It's going to be kind of dry. Okay, go ahead and take your time. Okay, this is nitroglycerin. This is a tablet that you put underneath your tongue. I want you to go ahead and put it there and then just let it dissolve. Don't swallow it. Okay, it's going to taste funny. I'm also going to hook you up to a blood pressure monitor that is going to watch your blood pressure for us, and it's going to take your blood pressure every couple of minutes. So don't get alarmed when you feel it pumping up around your arm. I also need to start an IV, and I'm going to do that in your right arm.
Aspirin should be given as soon as possible to all patients with chest pain suggestive of AMI. Aspirin tends to reduce overall mortality from AMI, as well as the chances of non-fatal reinfarction and non-fatal stroke. Nitroglycerin is often routinely administered to patients suspected of having an AMI. The clinical goals include providing a better match between oxygen supply and demand in the myocardium and pain relief.
Mr. Schuler, we're going to get you something for that pain in just a minute, okay?
Mr. Schuler, do you feel any relief from the nitroglycerin yet?
It's no different than before.
What are his vital signs like?
Can't you do something about the pain?
Blood pressure's about the same. It's 158 over 104. His heart rate's around 100. Monitor shows he's still in a sinus rhythm.
Normal sinus rhythm does not rule out ability of AMI. The patient's history of crushing substernal pain of more than 15 minutes, unrelieved by rest or nitroglycerin, as well as the ulnar distribution of pain and shortness of breath, indicate a likely AMI.
There's some ST elevations in the anterior leads. Mr. Schuler, you might be here with us for just a little while. We're going to try and make you as comfortable as possible. Terry, I'd like you to start an SL nitro. Drew, I'd like you to start 2 milligrams morphine IV every 5 minutes until the pain's relieved, and keep a good eye on the vital signs. I'm just going to listen to your chest for a moment, sir.
Okay, Mr. Schuler, this is another sublingual nitro, just like the tablet I gave you before. Put it under your tongue and just let it sit there, okay, until it dissolves. Great, thank you very much.
2 milligrams of morphine in.
Mr. Schuler, again on a scale of 1 to 10, how's your pain feel right now?
About a 6.
Morphine should be given in cases where the patient experiences continuing pain. In addition to pain relief, morphine reduces myocardial oxygen demand by increasing venous capacitance and decreasing systemic vascular resistance. Reduced oxygen demand leads to less ischemia and infarct extension.
Mr. Schuler, again, on a scale of 1 to 10, how do you feel at present?
A 4.
What are his vital signs like?
Blood pressure is 156 over 104. Respirations are 16. His heart rate's still around 100. He's had a total of 2 sublingual nitro and a total of 4 milligrams of morphine IV.
Drew, I want you to finish pushing 2 more milligrams IV of morphine. Want this man pain-free.
Okay.
We're going to need a CC order sheet, portable chest, and full cardiac workup from the lab.
Okay, do you want to go ahead and start him on thrombolytics?
How long has he been having chest pain?
For about 4 hours, since about 5 o'clock this morning.
Okay, we're going to need to start up something pretty quickly.
This patient has a history of pain consistent with AMI. He also has an ECG consistent with AMI. He presents no absolute contraindications to thrombolytic therapy, as well as no relative contraindications. Thrombolytic therapy is therefore indicated and should be initiated within 30 to 60 minutes of the patient's arrival in the emergency department. Some common errors in a situation like this include failure to consider and properly evaluate a patient with acute chest pain suggestive of AMI, failure to obtain a 12-lead ECG in a timely fashion for patients with possible AMI, failure to initiate oxygen and other indicated medications for a patient with possible AMI, failure to attempt to control pain in a patient with AMI, failure to recognize exclusion criteria for use of thrombolytic therapy, and administration of contraindicated medications.